Thank you, Mr. Whitty, for agreeing to testify before us today. Like Chair Griffith, I was disappointed that your organization declined our original invitation to testify on the cyber attack on Change Healthcare, one of your subsidiary companies before, and we had invited you to testify in front of the Health Subcommittee, but appreciate your cooperation in being here today. Most Americans have likely never heard of Change Healthcare, despite how crucial its functioning is to ensuring their access to care. Change acts as a clearinghouse for 15 billion medical claims each year. That means more than 50%, or right at 50% of all claims pass through Change. That covers everything from routine checkups with primary care physicians to life-saving cancer treatments with specialists. Things that we, until recent weeks, took for granted. In 2022, your company acquired Change Healthcare as a part of the growing creep into every corner of our healthcare system. Under the United Health Group umbrella resides a health insurance company with more than 40 million covered lives across Medicare, Medicaid, and commercial markets, a PBM that managed $159 billion in drug spending last year, a provider group that owns roughly 1 in every 12 doctors in the United States, a bank that makes payday loans to providers. And that's just a few of the ventures under your purview. I say this to emphasize the massive responsibility that comes with your position, Mr. Whitty. With a family of 4 that's being crushed by inflation, you think that they're forking over more than $20,000 per year for their health insurance. When a senior citizen sees the AARP brand on your Medicare product, when a taxpayer funnels tens of billions in subsidies to your company, there's a reasonable expectation that they will get a baseline level of value for their hard-earned money. But I'll set the bar higher. You have a responsibility to protect the data of the people who have put their trust in you. Or more bluntly, in this case, you failed. On February 21st of this year, Change Healthcare announced it was hit with a cyber attack, severely disrupting the healthcare ecosystems for providers, payers, and patients. It's been more than 2 months since this cyber attack, and according to your own company's website, Change has yet to fully restore its services, and many negative impacts for our healthcare system persist. As your written testimony lays out, criminal hackers gained access to Change Healthcare through compromised credentials, so they were remotely accessing the company's portal 9 days before your company announced publicly the ransomware attack. This portal did not have multi-factor authentication enabled, a relatively basic protection against cyber attacks, which allowed the cyber criminals to unlock the door and break into your systems. Multi-factor authentication would be a basic expectation for a company handling the breadth of sensitive information that Change Healthcare does. It's now been reported that your company paid a ransom to cyber criminals. While I have grave concerns with the precedent you created by rewarding the criminals, I would understand that it would be a difficult decision to weigh that against protecting Americans' data. But here's the problem. It didn't stop the data leak. Americans' personal and private health information is on the dark web. This is private health data that you were responsible for protecting. Mr. Whitty, I suspect that decision will be a case study in crisis mismanagement for decades to come. I would be remiss if I didn't note that providers, especially small providers and solo practitioners, continue to provide uncompensated care as submitted claims cannot be processed through payers. It's been reported that some providers are contemplating closing and others have been forced to rely on volunteers to care for patients. Others have had to furlough staff so their employees can apply for unemployment benefits. I look forward to hearing how this is going to be fixed as soon as possible. I'll note in closing that we're here today to learn more about what happened in the lead up and during the attack and what you, Mr. Whitty, are doing to fix it and prevent it from happening again. The American people, especially the millions who rely upon Change's services and those whose information was leaked, deserve answers. I yield back.
Gentlelady yields back. Now recognize the ranking member of the